Welcome back to Tuesday. It's BT Vancouver, 8:45. We're talking health news right now, and obviously COVID-19 dominating the headlines when it comes to health. We're going to bring in our good friend, Dr. Yvette Lu, family physician, and I love this segment, Dr. Lu. Welcome, by the way.
Thank you. Good to be here.
Today we're going to be debunking some common COVID-19 myths. Just a couple of minutes ago, I was scrolling through Twitter. I saw a tweet headline from the New York Post claiming that the summer sun can get rid of COVID-19 in 34 minutes. What say you, Dr. Lu?
Well, we don't know a lot about the coronavirus because it's a novel disease, a novel virus. There are some viruses that have a seasonal pattern. For example, the seasonal influenza comes in the fall and winter and goes away in the spring and summer. However, we have to remember that seasonal viruses behave differently from pandemic viruses. Also, influenza is a different virus from coronavirus. So we have to be really careful when we look at the influenza and compare it to the coronavirus. Also, the coronavirus is a new virus, so we don't know a lot about it. However, researchers have looked at how the coronavirus behaves in countries around the world in different climates, and they have found some preliminary evidence. It is mixed, but there is a little bit of evidence that shows the coronavirus may spread less quickly in areas that are humid and hot. However, we have to be cautious because areas like India and Indonesia, which are warm and humid, and areas like Florida and Texas and Arizona, which are hot, still have had problems with the spread of coronavirus. So warm weather, if it's a factor, is going to be only one small factor. Things like physical distancing, population density, the quality of the healthcare system, and other things, other public health measures like that are going to be most likely more important than the warmer weather. And we still have to maintain physical distancing, wash our hands, and test and trace contacts.
What about the link between the sun and vitamin D when it comes to fighting COVID-19?
Vitamin D is an important important hormone involved in the immune system. So it is important to have an adequate level of vitamin D. Some researchers are looking into whether or not vitamin D might be good for treatment or prevention of the novel coronavirus. However, we don't have enough data to say that vitamin D is something that we should all take to prevent the coronavirus. However, if you are deficient in vitamin D, and many Canadians are because of lack of sun, because we're far away from the equator, and because of lack of vitamin D in the diet, then it is useful to take a vitamin D supplement. So I would advise people who think they're vitamin D deficient to talk to their doctor about whether or not it would be useful to take a supplement.
All right, the other area you want to tread very cautiously around is home remedies. Are these a good idea? Do they actually work?
So there have been a lot of home remedies going around on the internet because the coronavirus is a scary virus. So people sort of want to do whatever they can to prevent it or treat it. I would advise against home remedies. There are no proven treatments for the novel coronavirus. So things like drinking boiling water can be harmful, can cause burns, or breathing in steam from boiling water, or drinking things like lemon juice. At best, these kinds of home remedies are ineffective, and at worst, they can be harmful or toxic. Some of the things that, go ahead.
No, go for it, yep.
Some of the things that people also do are doing home tests, like holding your breath for 10 seconds, and that is not a useful test for coronavirus as well. If you're worried about coronavirus, you need to see a doctor. Don't do any home tests.
Wow, okay. Thanks for that clarification. And we know it's the morning, people are eating breakfast, but this is one that often comes up. Can flushing a toilet spread COVID-19?
We do know that the novel coronavirus can be found in stool. However, we don't know right now whether or not the virus found in stool is infectious. However, a recent study of computer modeling showed that it is possible when you flush the toilet for a plume to be created when virus particles or particles can be aerosolized into the air. These virus particles can hang in the air for as long as a minute and can go as high as 1 meter above the ground. And we don't know if these viruses are infectious. We don't think that this is a major means of spread of COVID-19 because we know that COVID-19 is spread by close and prolonged contact. However, it doesn't hurt to be cautious. So when you go to the washroom, especially in a public place, you want to clean the toilet before using it. Close the lid, if there's a lid, before you flush, and then make sure you wash your hands really carefully after touching any surfaces or anything in the toilet and washroom area. If you're in charge of a public toilet, make sure it's cleaned frequently, and try to have a ventilation system that's on all the time and has air exchange with the outdoors.
Okay, great information there, Dr. Lu. We thank you so much for your time today.
Thank you. Good to be here.
Okay, you take care. That's Dr. Yvette Lu. We'll get this online for our viewers, debunking some common COVID-19 myths, and we'll be back with more